Okay. All right, now starting. So this is what we have. We want to talk about the bones of the upper limb. So within the bones of the upper limb, we want to first start talking about the clavicle, which is this bone that you're seeing right here, the clavicle. Let me just try to isolate it. So when I isolate it, you can see it. So a clavicle is a long bone. It has no medullary cavity. It appears to be elongated and giving us a shape of we can say an S-shaped bone when it's lying on one side. So the other thing that you need to remember that it is a double curved long bone that lies horizontally on the root of the neck. Besides that, you need to remember that it is subcutaneous throughout its length. Okay, so it has got size that we're going to talk about. So first of all, it has got two ends. We have got this end that we call the sternal end, which you are finding here. This is our sternal end, with the one that you can see on the screen right now. And if we go the other side, if we tilt it, we've got the what we are calling the acromial end. So the sternal end, normally it's going to give us another shape that we're going to say it's enlarged and it's a triangular. When we go to the acromial end, we are going to see that it's flattened and it has a body. This is its body. So its body, or what we call the shaft, it is convex forward two-third. So this is like a convex shape two-third, and on its lateral side it is convex forward one-third. It has got two surfaces. So it has got this surface that is here, that is what we refer to as the superior surface, and it also has another surface which is below it, which we call the inferior surface. So the superior surface, normally it's going to be smooth, and the inferior surface is going to be rough because it's going to be attaching to the ligaments, and also it also binds to the first rib. So we want to talk now about the important points that we are going to see here. So here we have got our sternal facet, which is going to be articulating with the sternum, and we also have here which is actually just like our sternal end. And here, and when we go on its inferior surface, we are going to see there's an here that attaches to the, we call it the costal tuberosity, because that is where it is attaching to the rib, right? And if you check somewhere here, there is like a groove that you can see, which is mostly like a C-shaped, and that groove we call it the what? We call it the subclavian groove. And just after that, when you're about to finish, where there's the junction between the anterior two-third and the medial tooth and the posterior two-third, one-third, you can see that we've got another point that I'm going to point here. We call it the conoid tubercle. The conoid tubercle is the one that is going to be attaching to the conoid process of the scapula. And if we go to the other side, we are going to see here, we've got another line that we are seeing here that we normally call the trapezius line. And if we go here, our last point here, last but not least, on the inferior surface, we are going to see another attachment here that we are going to be calling the acromial facet. Here it's articulating with the acromion process of the scapula. And if we check here, we've got an acromial end. So that is it for the clavicle. So normally, what about its fractures? It can be fractured. Normally, the common fractures that we're going to see, we see it normally in children when there is force, or when they fall with an outstretched hand, we can see that there can be a fracture. And the fracture, mostly it's on the medial fragment, it's elevated. So we can see that the sternocleidoid mastoid muscle is going to be elevated. It's going to elevate it, so it's going to bring it a bit up. So it can be pulled medially by the adductors of the arm, sagging the limb, and it is supported by others. So mostly that is what we can talk about the clavicle. We talk about the fractures. We've talked about the fractures. We've also talked about the important points. For now, we are just going to skip the muscles that attaches to it. So we move on. We go on to our upper limb. We are going to isolate, and we are now going to talk about the clavicle. So this is our clavicle. About our scapula. So this is our scapula. So our scapula is more like a triangular bone. Let me just isolate it. It's more like a triangular bone, and it's also a flat bone that lies between the second to the seventh rib. that lies between the second to the seventh rib. It has got three processes. So the processes that we've got the spine, and we've got the acromion, and we've got the coracoid. So our spine, this is this part that you're seeing here, this line that you're seeing here. It's unfortunately that I don't have anything that I can use to annotate for now, but you can just appreciate it. Just as you are ending the spine, we've got another process that we call is the acromion process. The acromion process is actually subcutaneous and is the point of the shoulder. You can actually feel it. And we've got another process that we are seeing here, which is just above the glenoid cavity, that we are calling the coracoid process, which attaches to the coronoid process of the clavicle that we're talking about, right? So it has got three borders, and on the three borders we are going to talk about this border, which we are going to be calling the medial border, and we've got also this border that we are going to be calling the lateral border. And we can also have another border sometimes that we can refer to as the lateral angle, but for now let's just focus on the medial and the lateral border. Those are the most important, and it also has got angles that we are also going to be seeing. So the first angle that we have, that we find there, is going to be the superior angle. So on the superior angle we also have got an inferior angle, which is this side. So once we are done with this, it also has got two surfaces. So it has got a convex posterior surface that is divided by the spine of the scapula. So we have talked about the spine. So this is the convex posterior surface. It's found on the posterior aspect, so it's divided into two. So it's divided by the spine of the scapula. So we are going to have in supraspinous fossa, which is this one, and we are also going to have an infraspinous fossa, which is this one. So here we move on, we go to the anterior aspect of it. We are going to have another surface which is going to be concave anterior, or the costal, which is the one that accommodates another fossa that we call the subscapular fossa, because it houses the subscapularis muscle. After that we are going to move. We want to talk a bit about here. When I'm facing here, when it's facing like this. So from here we can see that we've got what is called what we are going to be calling the glenoid cavity, which articulates with the head of the humerus to form the shoulder joint. This is what we were going to see here. And just above it, since we say it is a glenoid, just above it or superior to it, we are going to have what we are going to call a supraglenoid tubercle, and just below it we are going to have an infraglenoid tubercle. And now after that we go on to the spine. The spine, we've talked about it. This is the spine of the scapula, and this is just like a lower lip of the spine of the scapula, and here this is the upper lip of the spine of the scapula. So these are the most important points that you are going to find. We also have got an angle that we are going to be finding here, which is going to be called the suprascapular notch. And this suprascapular notch, it's where it's going to be passing through. Is it the it should be the axillary artery. Anyway, so that's it for the clavicle. We move on. We are going to get into the next bone, which is going to be the humerus. So the humerus is also one of the most interesting bones that we are going to see. So let me just put it this way: the humerus. So this is our humerus. Our humerus is a long bone. Typically, it has got a head, neck, and the body, or the shaft. So this is its head. It's about 2/3 of a sphere. It's about 1/3 of a sphere. Sorry. So it articulates with the glenoid cavity of the scapula to form the shoulder joint. So just after there, we've got a neck that we're going to see here, which is let me try to demonstrate it from here. So this is called the anatomical neck, and it also has now 2 points that we are going to be calling the tubercles. So we've got this one, we call it the greater tubercle, and we've got this one, we call it the lesser tubercle, and we also have got this line in between these tubercles. We are going to be calling it the intertubercular sulcus or groove, which is this one. So according to this application, but this is going to be the medial lip. This is going to be the medial lip of the groove, and we've got the lateral lip and the medial lip from this side, right? After that, we are also going to see just inferior to it, we can see like an attachment where there's going to be attachment of the deltoid major muscle. That is the one we are going to call the deltoid tuberosity. And if we go on the posterior aspect of it, we are going to see there's going to be like a groove, and that groove is very important because the examiners, they like to ask about it. So the examiners, they like to ask about this one. This is going to be called the radial groove. It houses the radial nerve in the profunda brachii artery. So fracture to this, we are going to damage the radial nerve, which normally innervates the extensor compartment of the arm. And as we move down, we are going to see that we are going to have more like ridges that we are going to see. So they are going to be called supracondylar ridges. So we've got medial and lateral supracondylar ridges. So this is our medial supracondylar ridge, and this is our lateral supracondylar ridge. And just below the condylar ridges, we are going to have what we call epicondyles. So mostly like the medial epicondyle is actually palpable and is cutaneous. You can actually feel it even if without a flexed, or even especially with the flexed hand. If you can feel it, you can feel it on the elbow joint. On the elbow joint. So here we go. This is our medial epicondyle, and this is our lateral epicondyle. And as we go there, we are going to see something that looks like a trolley, or that looks like let's say a trochlea. So this is going to be a trochlea. This is going to be a trochlea. Above the trochlea, we're going to have a fossa that is going to be accommodating the coronoid process of the ulna. So it's going to be called coronoid fossa. And just after that, we're going to also have what is going to be called the capitulum, just next to the trochlea. This is this one, and above or superior to the capitulum, we are also going to have another fossa that is going to be accommodating the radial fossa. So it articulates the radial process of the radius. On the posterior aspect, we are still going to see another fossa that we are going to call the olecranon fossa, because it accommodates the olecranon process of the ulna, which is this one. And this is still here. Oh, I forgot that I don't have the pin so far. I forgot I don't have the pin so far, but anyway, I just wanted to demonstrate something. So that takes us from the 3 bones of the upper limb that we have talked about. So for today, folks, we leave it from here, and we'll take it up next week.